Question about something that has come up around the country, which has to do with the National Healthcare Advisory Board that President Obama has promoted. And I think what the young lady just brought up about rationing has to be looked at, because what you're talking about, when the White House repeatedly says that 20% of the people in the healthcare market take up 80% of the cost. And Ezekiel Emanuel, who is one of the key architects of the Obama's policy, President Obama's policy, has written reports calling for saying that physician-assisted suicide provides a cost benefit. And you should read it. You haven't read it. I had the good pleasure to read that report.
Yeah, there's nothing like that in the bill.
Well, actually, if you look at where they say their model for this health care plan comes from, the National Institute for Clinical Excellence in England. What you are dealing with is dramatically higher rates of mortality for cancer patients. You're dealing with the kind of thing which Emmanuel has written for 20 years on rationing. And when you say that, well, look, 20% of the population in health care takes 80% of the cost. Frankly, a senior citizen or a disabled person should have more health care costs than I have. And so what I'm saying to you, when you have a philosophy like that, even if you don't see dead bodies, piled up at Auschwitz, when you calm down, I'll ask my question.
Come on, ask everyone to be quiet.
My question is, if you have a policy which essentially is saying, if you look at the cost-benefit analysis approach of Ezekiel Emanuel,
but it's not in the bill.
No,
there's no cost-benefit approach in our legislation.
When people in the Congress, there are 75 members of the House who said that they won't support a bill that has this National Health Care Board in it. The Obama administration has said this has to be in there. And my question to you is, if you have that attitude, what's the difference between this and Hitler's T4 program?
The obvious difference is one of intent and purpose.
Categories of people with cuts?
No. Obviously, if you want to try to find the areas where there's excess cost in a system, you go to the areas where the cost is the greatest in order to find it. But the purpose of the exercise isn't to take care away from people, because one of the blessings of the situation that we're in, as desperate as this situation is, there are some blessings in it. And one is that it has been shown over and over again that by and large, when you improve the quality of care for people, when you better coordinate all the multiple specialists who are surrounding one particular case, when you support a patient with a thorough, effective, integrated electronic health record so that everybody knows who's involved with their care, what is going on, you get better care and you get it cheaper. We're not replicating England. We're not replicating England. We're not going single payer. We don't have a nice, it just doesn't happen.
Listen,
you can argue the point. We're just not, we're not doing, that's not what we're trying to do. It's not.
It's not the model.
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 Understand?
It's not the model. We understand your question. We're trying to expand coverage to people.
They're cutting it. They want to cut in a few years $1 trillion out of Medicare and Medicaid. And what do you think happens? What do you think happens? No, I'm insisting that you haven't studied what they themselves say about
all those people we know. We're the ones who are writing the law. I don't care what Ezekiel Emanuel says. We're the ones who are writing the law. We know what we need.
They say it's a
and it's not going to happen.
Okay, we're going to take another question. We're going to take another question. We've been very kind. We've been very kind. Oh, yeah.
We'll do Marina, then we'll do John, and then we'll be done. Marina and John.
I've seen a lot of changes up when we didn't have health insurance. We went to the doctors and paid. My parents paid for it.
Yeah.
I can remember a time, maybe 30 or 40 years ago, when you used to get your Blue Cross bill with limited insurance. There would be items on it. You're supposed to check them off and see if you really got those services.
Yeah.
And those went away. My question to you is, both of you, do you really believe that the American people are able to take care of themselves and make their own decisions? Is that why you push it? Do you really think that if we had a good free market system with tort reform and things addressed like pre-existing conditions, you said something about it's too hard to read through that bill. Do you think that the American people can't do it and that's why you need it? Do you think we're stupid?
No, not a bit. I think that for a lot of people, dealing with health care is a real challenge.
Life is a challenge.
And then people help each other. But if you come into, I mean, certainly if somebody is unconscious, then other people are going to have to look after their health care for them. They can't make those decisions. If you're elderly, if you have multiple conditions, if it is really complicated, you can barely keep track of the pills you have to take, you have to have a health care system that supports somebody like that. You can't simply say everybody's on their own. Because what happens is...
Do you think that they're capable of picking insurance that would be right for them?
Yeah.
Like have a high deductible or whatever. Do you think that in a free market system, without the government control, if the regulations, we could shop... I've shopped for insurance for friends of mine in Texas. You can get, in Texas, you can get a family of 3 can get great coverage for $380 a month. If that was removed, do you think people couldn't be smart enough to figure that out?
The purpose of the exchange is to let them do just that. To go to the, no control whatsoever.
There'd be no government administrator or funding.
There's Blue Cross shows up, United shows up, Aetna shows up, they all offer it.
No government
The
funding.
funding we use to establish the exchange, then it would be run probably along the same lines of Medicare, which is contracted out. How many people here are on Medicare? Are you on Medicare? You're on? You're on Medicare, so you don't, are you getting coverage? Well, no one pays in as much as they get out.
Let me tell you that. All right, this gentleman, we're going to get to the last
Yes,
one.
That's right, you have to shop.
Part of the problem of our communication is that it is not just who's saying what here, but how it gets perceived by the press. And I strongly believe that I'd like you to ask the question of the group that's sitting here. The talk has been dominated by people who are critics and whose manners are different than some of us might like. And what I would like to do is have you invite people, for example, stand who are here in support of the healthcare reform system, so we can see that in fact the people who are the most vociferous are in fact in the minority. All of your hands have been up forever, and you keep dominating it if there was not a more fair system.
I didn't vote for either one of you guys. So what are you talking about? And I probably won't vote ever for them either. Yay!
All right.